notification that we are recording. Welcome everyone. My name is Melissa Meza and I will be one of your facilitators today alongside our partners at Everyday Impact Consulting. You probably already saw them interacting in the chat. I am a senior program manager at Health Begins, and at Health Begins, we are a mission-driven consulting and training firm. And it's our goal to help healthcare and community partners improve the social and structural drivers of health equity for patients and communities, similar to a lot of you who are on the call today. We'd like to extend a special thank you to the Department of Healthcare Services for funding this incredibly important initiative and the Public Consulting Group for administering this program. Before we get started, I'd like to kick some things off with a little bit of housekeeping items that will provide a great foundation for today's session. First of all, we'd ask you to please update your Zoom names. You can include your name on Zoom and include the name of your organization. If you have space, you can also include your pronouns, whether that be she, her, him and his. Second, we'll get us started with an icebreaker. We are going to use the chat for this. So to learn more about the makeup of who's here, we'd like to have a little bit of fun with some emojis. So hopefully you are all getting ready to drop your emojis in the chat. Please share how comfortable you are with CalAIM. First, if you are CalAIM curious or new to CalAIM, please drop a blue cap in the chat. If you are somewhat familiar, please go ahead and drop an eyeglasses emoji in the chat. And Alexis is dropping the icebreaker into the chat right now. If you're very familiar with CalAIM, please go ahead and drop a graduation cap in the chat. This will allow us to support you in better tailoring the conversation and to understand who's in the room, as well as really just share more of a networking opportunity. It'll help you determine how you can connect with others. For those of you who are very familiar, we might rely on you to step in, share more information. So please go ahead and interact with the chat and just let us know. And then finally, and most importantly, we want to strongly encourage you to engage. This space has been designed specifically for you so that we can work together to make CalAIM a success. So in addition to posing questions towards the facilitators, myself, Alexis, who is managing the chat today, and our partners at Everyday Impact Consulting, please peer network, engage with one another, and uplift your experiences and needs. For today's session, and with that being said, we have 3 objectives. The first will be to understand the goals of the Collaborative Planning and Implementation Initiative. The second will be to understand how CPI will support your ability to successfully provide CalAIM services. And finally, we want this to be a networking space. So ideally, this will be a space for you to network and strengthen relationships with other CalAIM stakeholders, such as providers and plans. In order to accomplish this, we've broken today's agenda down into 3 parts. The first part includes setting the stage. We have a few assumptions about who's here. We'll also go through a few introductions. We'll cover what is CPI. If you're new to CPI, this will give you the foundational framework to understand what CPI is. We'll also cover some of the CPI objectives, and then we'll have a few transition statements from some of our previous partners. Finally, with part 1, we'll identify how we'll work together over the next year, and then we'll close part 1 out with reflections and a Q&A. Part 2 will be the bulk of today's session. This includes developing shared goals. We have a few activities. We may put you into breakout rooms, and we'll have a Jamboard session. So this includes designing guiding principles. In between that, we'll provide a quick CalAIM refresher, and then closing out this part 2 with informing the project charter, which is where we'll set you up into these breakout rooms and give you an opportunity to further strengthen your networking relationships. We'll close that out by bringing you all back for reflections and again, Q&A part 2. Finally, this session will conclude with next steps. We'll discuss what comes next, go over immediate resources, and then provide a special thanks. And yes, thank you, Alexis, for dropping the agenda in the chat. As a reminder, the session is being recorded, and so we will share the session recording after it, and you will have access to all of the materials. Before we move forward, I really want to just kind of share, we are setting the stage for this first kickoff session. Before we get started, like I mentioned, we have a couple assumptions about who is here today. First, you represent a California-based organization that is located in or provides services in Shasta, Trinity, Lassen, Modoc, or Siskiyou counties. Your organization is interested in or is currently providing CalAIM services pertaining to enhanced care management or community supports. Third, you have registered to participate in the CPI collaborative. And then finally, you are committed to improving the lives of Medi-Cal beneficiaries and collaborating with colleagues to achieve the goals of CalAIM. And please let us know if we're right. Before we dive any deeper into this and get into our introductions, we want to quickly pull up a poll. So Casey-Ann is going to pull this poll up, and just please let us know, review the list of historically marginalized populations or underserved communities below, and let us know which of these populations represent at least 20% of the individuals your organization served in 2022. Again, please check all that apply, and then we'll leave this poll open until we get about 50% participation, and then we can share afterwards. Perfect, and I think we can go ahead and share that poll. All right, so it looks like about 75% worked with Medi-Cal eligible children and adults, 81% working with rural communities. That checks out. Then we also have about 50% working with people with disabilities, those experiencing homelessness, and adults with serious mental illness or substance use disorder. Thank you so much for sharing. And this is really helpful. What is BIPOC? Sorry, I totally just blanked out. Alexis, can you jump in here? Yes, Black, Indigenous, and persons of color. Thank you so much. All right, so we're going to go ahead and move into some introductions. I am going to encourage you all to please turn on your cameras so we can see your beautiful faces. I see a lot of people with their cameras off. So I'm going to let everyone take some time to turn their camera on really quick. And Alexis, if you want to go ahead and stop sharing so everyone can see each other. Thank you. I see Danielle. I see Jenna, Trisha, Natalie. Thank you so much for turning your camera on. Casey, Doreen, thank you so much. Okay, Barbara, we'll give you a pass today. Thank you so much for letting us know. Tanya. Okay, so for this, I do want to go ahead and get us started by introducing Vince and Maiku. So Vince, if you want to go ahead and just give us a quick introduction, please share your name and the organization you represent, and then let us know what you're hoping to get out of today's session.
Hello, Happy New Year, Happy Lunar New Year to everyone. It's great to be in this space. My name is Vince Salas. I'm with Everyday Impact Consulting. And what I'd like to get from this space is really try to get to know you a little bit more and see all of you engage in this process.
Thank you. And we'll go ahead and hand it over to Maiku.
Thank you, and good afternoon, everyone. My name is Maiku Tao. I'm a part of the Everyday Impact Consulting team, and I am super excited about this. Not only I live here in Sacramento, but my home, I call Butte County my home, and I'm graduated from Chico State. So to me, the North State is always going to be a home for me, and really excited to be engaging here today with all of you.
Thank you, Maiku. And I did forget to add that I was also raised in Tehama County. Love Northern California. I also went to Chico State University. So Maiku and I are really excited to work with all of you. We are gonna select 3 participants, and also if you are not selected, please feel free to use the chat and just let us know your name, the organization you represent, as well as what you're looking to get out of today's session. I'm going to go back into the chat and just look. T. Abraham, I'm not sure if that's your first name, but if you could unmute and just share what your name and organization is, and then also what you're looking to get out of today's session.
Excuse me. Hello, T. Abraham. I'm with the Hospital Council, and I serve a lot of the hospitals in the North State. And I'm not sure which counties you cover. I'm guessing it's Shasta, Trinity, Lassen, Modoc, and Siskiyou. Yeah, I work with all the hospitals in those counties, and I also work with the counties and in the communities, doing all kinds of different kind of advocacy and collaborative work. And I've been working with Danielle a lot to try to implement CalAIM in the rural area. It's extremely challenging. Quite honestly, I think it's flawed as it's constructed for the rural areas right now. And so I'm looking for ways to see how it can work in rural areas where the infrastructure simply doesn't exist to do what all of us want to do and have wanted to do for years.
Thank you so much, T. And I just want to echo a lot of what you said. You know, some of this doesn't always align with our rural communities. And so I think that's why Everyday Impact Consulting, as well as Health Begins, are really eager to support your community and not overstep, just kind of support you and guide you in this initiative. So thank you so much for sharing that. And we are looking forward to connecting with you further. Also, a huge shout out to Danielle for supporting with our recruitment and getting people on this call today. I am going to go to someone who dropped an eyeglasses emoji. And so let's see, Jenna with Siskiyou County.
Hi, I am Jenna Gabriel Ferris. I've been with public health for since May of 2020. And I came from a background in social work with CPS, or Child Protective Services, and then Adult Protective Services. So I'm not super familiar with CalAIM. I was hired on as the correctional discharge planner for our county jail. So just trying to connect our people that are incarcerated to Medi-Cal before being released. That's kind of what my role has been. So yeah, I'm just looking forward to learning more today. Thank you.
Thank you. And as you can see, we do have a very diverse group of stakeholders here. So hopefully you'll get the opportunity to engage with others and network and just use some of these individuals as a resource, as well as Everyday Impact Consulting and Health Begins. Okay, I'm going to close this out with picking one person who put a graduation cap, Natalie from Shasta County.
Hi, I'm Natalie. I'm from Shasta County, and I work for Shasta County Health and Human Services Agency. I'm a community development coordinator here. Been working on some CalAIM related initiatives, initiating them here, including ECM, which we're about ready to start. So that's me. And I'm hoping to learn maybe barriers and successes from other people's related to CalAIM initiatives.
Yeah, and we'll have an opportunity to touch on that during breakout rooms as well as during our Jamboard session. And so definitely encourage you to uplift that when we get to those pieces. But Alexis, do you want to go ahead and screen share again?
All right, give me just 1 second, Melissa.
You're fine. Thank you. And the next slide, please. Thank you. So we're going to quickly touch on what is CPI. I know some of you are new to CalAIM, others are not. And so we're just going to briefly touch on this. We understand that CalAIM is incredibly multifaceted. So before we take a deep dive into what CPI is, We want to start by explaining how CPI fits into CalAIM. CalAIM is a long-term commitment to transform Medi-Cal by offering a more equitable, coordinated, and person-centered approach to improving population health. This transformation includes the expansion of services that brings new providers into the Medi-Cal landscape. There are many ways for providers to participate in CalAIM, and our time together will focus on enhanced care management and community supports providers. CPI is a space for CalAIM stakeholders such as community-based organizations, managed care plans, tribal health programs, and county agencies to network, uplift CalAIM challenges, and identify solutions to contracting and implementation in a supportive space. Again, your seat in this collaborative is fully funded by the PATH program. And then just to close out PATH, to achieve the goals of CalAIM, DHCS has funded the Providing Access and Transforming Health initiative. PATH is a 5-year funding plan to support stakeholders like you, those of you who are in the room, in successfully participating in CalAIM. PATH does have 4 programs, and CPI is one of those 4 programs. All right, before we move forward, we're going to go ahead and pull up another poll. And Alexis, if you can go to the next slide. Thank you. So we have another poll here that's going to allow us to, again, assess who's in the room, where you're at with PATH. And so if your organization has received any PATH funding to date, please let us know if you have received cited funds, you received IPP funds, you've applied for funds and are pending approval, you're planning on applying for funds, or you don't know what funds to apply for. And then we'll let that go up until about 50%, or when we see people stop interacting. I think we can go ahead and share. All right, so it looks like most are saying we don't know what funds to apply for. So we'll definitely provide more information as the sessions progress. Thank you so much for participating in this poll. We'll go ahead and go to the next slide, please. So how does all of this impact you? If you're an organization that has experience providing the services CalAIM now covers, such as housing, navigation, or medically tailored meals, you can pursue an opportunity to retain a contract with managed care plans to provide these services. I just want to call out, we do have a managed care plan on the line today. This means that you can get reimbursed by a plan for services rendered. Organizations in the CPI collaborative will be at varying stages, as you've already seen. We had a ton of blue caps, we had graduation caps and eyeglasses emojis. So we will work to address the needs of providers based on where they are in the process. Next slide, please. And Alexis, it's not, oh, thank you. So before we planned out today's session, we wanted to just kind of share back on what we've heard from you. A lot of this information was pulled from the registration that you submitted to the PATH Collaborative Planning and Implementation Group. And so what we've heard is that stakeholders need improvement of operational workflows and processes to understand how funding can be used to build capacity and expand. You're also looking for a space to network with peers in order to learn best practices. Additionally, to develop partnerships that improve care coordination, peer learning to improve specifics around CS and ECM programs, and finally, to understand what services your organization can render. Among these, the topics stakeholders need the most support with are capacity development, improved care coordination, data sharing, workflows and systems, but this isn't limited to these 4. There are a lot of other needs that we heard. They're just not included on these slides, but will be uplifted during other sessions. And just to kind of transition, so we want to touch on what are CPI's goals, just so everyone has a good baseline understanding of what these goals are. Oh my God, sorry, Alexis, your chat threw me off. We realized that working with Medi-Cal and navigating the Medi-Cal billing process is a new experience for many current and potential providers. CPI will provide a space for participants to network with one another, engage, manage care plans, and uplift the challenges they are facing in order to collectively identify solutions and strategies to move you towards success. This will happen in 3 ways. The first will be to convene stakeholders such as community-based organizations, public hospitals, county agencies, and tribal programs in order to discuss CalAIM. We'll also identify challenges throughout our convening. We'll identify challenges pertaining to the contract and implementation process and anything else that we're hearing as a result of today's session. And then we'll work together to resolve issues. Through this work, we encourage thought partnerships, solutions development, and work planning. And again, we'll also build on these goals as we hear from you during these sessions. And before we move on, so how we'll accomplish these goals? We already have a preliminary framework that we're working off of. And so this collaborative will meet on a monthly basis to issue spot and work plan. These sessions will be held virtually and in person. We will be sending out communications to gauge your availability for those in-person sessions. So we are hoping to bring you all together in the Northeast region to meet in person and really network and collaborate as we get through this year. And then we'll work jointly to develop guiding principles, an aim statement, a project charter, and more to ensure we're leading the collaborative as participants have designed and requested. We'll actually kickstart some of this today. And then we'll collaborate. So our goal is to uplift your CalAIM experience, to share our shared success. Participants are expected to collaborate with one another, share best practices, and present their challenges, provide feedback, and complete surveys. As you've noted, there is a very diverse group here. And so we are encouraging you all to support one another to really move the CalAIM needle forward. All right. So finally, we understand that a number of organizations, including Partnership Health Plan and the Integrated Care Committee, serving as the steering committee for the Whole Person Care pilot for Shasta County, did amazing work convening CalAIM stakeholders before CPI launched. So it's incredibly important that we uplift that the work you have done, the relationships you've built, and the prior planning that has already been completed is not being uprooted. This is a space that we are building upon the learnings from prior phases of work, and conveners across counties are working together to listen to your needs so that we can support you in successfully implementing CalAIM. That being said, I'm excited to have the managed care plan supporting your counties uplift what their hopes are for CPI and how we're working together to make this collaborative a success. I would like to welcome Danielle. I already called her out earlier, but I want to welcome her to unmute and introduce herself, as well as share how we are working together to make this collaborative a success for all of you.
Thank you so much. Good afternoon, everyone. I'm really happy to be here. And I really want this forum to be supportive. We want to be a supportive partnership with all of our providers and community organizations and Health Begins. And thank you all for being here today. I know there's a lot of competing priorities and meetings and other trainings, and so we appreciate your time. I want to just express that we're really trying to work with Health Begins to ensure that there's no duplication of other meetings. You may recall that we have roundtables. Partnership offers roundtables for ECM and community supports providers. And over the last year, they've really evolved. We've talked about various topics and had guest speakers. And so that's focused more on operational or technical support. And so this is going to be separate than these meetings. So we just want to make that clear that it's not duplicative. We'll work very closely together to make sure that that doesn't happen. But Partnership Health Plan wants to be play a supportive role here. And so I just wanted to share that with you and know that we're here to support as well and work together so that CalAIM can be successful, enhanced care management, community supports can be successful, because we can't do it without you. Thank you.
Thank you so much, Danielle, for providing that. And I know there are other groups on the call today who have existing collaborative groups that they have been hosting for some time. We'll be connecting with a lot of you potentially offline to kind of identify how we can grow this group and not duplicate efforts. So please just let us know if you have any comments, concerns, and you can always drop those in the chat now or share those with Alexis and I offline. Next slide, Alexis. Thank you. So before we end and move into our Q&A, we just wanted to share some key takeaways from this section. So CPI is a space for CalAIM stakeholders to convene, identify challenges, and uplift solutions that will support CalAIM contracting and implementation. Second, we will collectively determine the participant priorities and goals, and over the next year, we will work together to achieve them. And then finally, CalAIM Links and CalAIM roundtables are coming to a close, and these meetings will build upon the lessons learned from these prior initiatives. Next section. Thank you, Alexis. Before I hand it over to our co-facilitators, we just wanted to pause and open up the room for some Q&A, see if anyone has questions in the chat that we can answer before we move forward. This can include anything on CPI background and goals, how CPI impacts you, how we'll work together, as well as the program transitions. I see Michael is unmuted if you want to share or ask any questions. Alexis, could you describe a little bit about the difference between the IPP versus the cited funds?
Absolutely. So, hey, everyone. I am so sorry I did not have an opportunity to provide an introduction earlier. I am a little under the weather, but I'm still providing some technical support to my colleague Melissa for today's session. My name is Alexis Taylor. I'm one of the senior program managers here at Health Begins as well, and I'm also the program lead for our San Joaquin and Stanislaus sessions. And so while today's session is really going to be an orientation to CPI and just really understanding what the goals of this collaborative are, we are going to head into a breakout room later on in today's session where we are going to discuss the types of challenges that various stakeholders are experiencing, including those types of challenges that pertain to the funding process, like what is IPP, what is cited, how does cited fit into PATH, who can apply for it, when do the application windows open, so on and so forth. And so I will be so happy to break down that information and receive more about what your specific learning needs and challenges are pertaining to the funding process when we go into those breakout rooms. But for now, I also want to direct everyone to the very back of the slide deck that we were able to drop into the chat. There's actually going to be a breakdown of cited and IPP, or sorry, of PATH and IPP at the very back of that deck. And it's also going to include the differences in the form of a flowchart between those programs. So if you go to the very back, you can look over that information. And so like I was saying, we're going to provide a very high level overview of what the CPI program is today. And then when we head into our breakout rooms, we can definitely get into more very specific challenges that different stakeholders are facing, so that way we can chronicle those and know exactly what issues we need to address.
Thank you, Alexis. And just a question from Barbara, since CalAIM is open throughout the state, are the overarching goals for all collaboratives similar? So the Collaborative Planning and Implementation Group does have a set of goals. However, for each region, we will be developing our own project charters and aim statements. That's one of the activities that we'll work on next. And just stating our norms and what we're kind of expecting throughout this group. So each group will be uniquely tailored to the region, despite the CPI's overarching goals. And
then I just wanted to add on to what Melissa was saying, going back to what she opened up the group with at the top of the call, that this is your space, so all of the participants that are here right now are not going to be in a space in which content is developed and just facilitated to the participants. You will very much so be the determiners of what the goals of this collaborative are going to be. So going back to those high-level goals that Melissa referenced, we're going to have the same high-level goals to convene stakeholders, to identify those challenges, to uplift solutions. But what challenges are identified are very much so reflective of your needs. And then that will determine our work planning and the solutions that we need to put forward.
Yeah, thank you, Barbara. That makes a lot of sense. Any additional questions before we move forward? Perfect. It doesn't look like there's anything else. So I would like to welcome my partner, Mike Tao, to explain how we'll work together to develop shared goals. And Mike, I'm going to go ahead and hand over the reins to you.
Great. Thank you so much, Melissa and Alexis, for just providing that huge foundation as to how we're going to be spending our next year together, right? Several months together, learning from one another. And so, again, just really excited to be here with you all. If we could go to the next slide, we're just going to jump into a short little activity here. Again, today's an intro. And so, in terms of what our EIC team and Health Begins team would like to know is just how do you want to navigate this space together, right? We talked about this being a collaborative space. And so as you can see, and we'll drop the questions in the chat as well, but we want to hear from you all. How do you want to establish some community norms and agreements as we move along together collectively? And we've got a Jamboard that we will also be typing up responses to, but we'd love to hear from you all. What are some of those community norms? And so I'll read off the questions here. Number one, what do you need in order to show up as your best self? And number two, what norms and agreements will support us in helping you to reach our goals? And so just wanting to be very intentional, right? That this is your space and it's a collective learning space. So it is our goal and direction to really be a support to all of you. And so I'm going to pause there and just see if folks have anything. Feel free to drop anything in the chat as well. But just to, again, the questions are now on the screen as well on the board. So feel free to jump in and unmute or chime in here.
And again, we encourage everyone to turn their cameras on.
Do we have any brave volunteers? Anybody want to chime in on any of these community agreements or norms?
So I see in the chat that Barbara has added advanced notice for meetings if possible in order to prepare for the meetings. So that's one thing. And I just wanted to let everyone know just a few things that came up in our San Joaquin Stanislaus session that were just so important just to ensuring that we could work together in a space that is incredibly authentic. And so one of those things included being able to establish trust between the participants, making sure that we understand that we are coming into this space, not knowing all of the answers and not fully understanding, the challenges that we're facing. So it's okay to put everything on the table to say, I'm not exactly sure, but together we can find out. So just that mutual trust and understanding of one another was something that was really important, that was uplifted. And then just to give you another example, fun. That was one of the community norms that came out of the San Joaquin Stanislaus session. We're all inundated with meetings and we have only so many hours in the day, but seemingly a million things to accomplish. And so we don't want this to be another, I really hate to say mundane space. We want all of you to be here with us. And if that means like us figuring out how we can make work fun, how we can make actualizing equity fun, how we can make improving the lives of Medi-Cal beneficiaries fun, let's do that. And so there are no right or wrong answers to this. But going back to what Melissa and Mike expressed, this isn't our space. This is very much so everyone else's space. So you can let us know whatever you need to feel comfortable, any practices, norms, or agreements that you would want to put forward so we can make sure that we're hosting this space the way that you want us to host it.
Thank you, Alexis. All righty. Anybody else want to add additional norms or ways to navigate this space. I know I'll just share, wanting to acknowledge that we've been in COVID for the last couple of years. There's Zoom fatigue. That is something that is so real. And so it's very much our intention as your facilitators and holding this space that we make this as interactive as possible for you all. And so we do, ask that as you are coming into the space, you're bringing your whole self, right? We realize that, just the goals and intent of CalAIM, I mean, it applies to all of us, right? How are we bringing our full selves into this space as well? And how can we create that community of support for one another since we're all coming in at different levels of engagement with CalAIM? And so just wanted to also acknowledge that and really appreciate everybody again too for showing up.
And it looks like we have another suggestion. So there's so much work to be completed in each of these geographic areas. We sometimes work competitively, and this is an opportunity to figure out how there is room for all of us at the table, regardless of entity type. Thank you for sharing that, Barbara. I think that is really important.
So just to encourage someone else to build upon that if they choose to, something else that we heard that is just so closely tied to that, figuring out how there's room at the table for everyone. Something else that's come up to us is that there are competing interests. And we need to recognize and acknowledge the fact that everyone has something different that they are coming into this session trying to accomplish, and that sometimes that puts us in competition. And so I think it's so important for us to say that everyone here is on equal footing. There is no one participant whose voices or opinions outweigh someone else's. And so us establishing that collectively developed community of practice is quite literally built upon that foundation of equal footing. And so making sure that there is room at the table for all of us is definitely a norm that we're going to be so embracive of, just so embracive. And so I just hope that incites, other ideas for someone else, because sorry to sound like a broken record, just making sure we're creating a space that is just what you need. And if for anyone, that hasn't put forward anything, it also might be helpful to think about meetings that you've joined in the past and maybe processing it kind of like in the reverse, what didn't work? And if that didn't work, what might work here that didn't work somewhere else? There's definitely no need to call out the space, but, just letting us know what could work for you.
I just want to do one last check-in the chat here.
I will speak.
Oh yeah, go for it.
I appreciate you all saying you were at Chico and in the North State. And I see a lot of different consulting firms on here. I've worked in urban and rural is very, very different. And for me to be here and participate, I need to know that you guys get that, because already just in the comments about competition, I don't know how much that applies in the rural area. There's not much competition. There's a lack of services. It's not about competition. It's about there's no existing infrastructure to do these things. So I don't know how much experience you all have in rurals, but for me to participate and continue in the meetings, this has to go from theoretical to actionable to results very, very quickly, because in the rural areas, that's just the only way it works. And we need to get out of the theoretical pretty darn quickly. And so I don't know how that translates into, as far as showing up. I mean, Danielle asked me to come to this first one, and out of tremendous respect for partnership and Danielle, I did. I'm a little concerned that there's been so much work done in the North State with collaboratives, with Hank and Shark and other things. That's I like to hear you say that fits in here, but I need to see that because to replicate that or to compete with that would be folly in my mind, and not a good use of time.
Absolutely. Thank you so much for just bringing that up, and I'm happy to chime in. And then for my other colleagues, feel free to chime in as well. But I absolutely agree with you. It is, our intention to also have facilitators who understand what we're walking into, right? And folks who can bring some of that lived experience. And so I'll just share a little bit more about my background. I grew up in a small town, rural town, Oroville, California. There were 2 high schools. We have 1 hospital. Like, that is literally the background that I'm bringing into the space. And I would hope that, it is exactly what you mentioned. Let's get out of that theoretical space and let's talk about action and how we're going to operationalize what happens in our rural communities. And so I totally hear you on that, in wanting to make sure that we create a space that is really meant to create those actions, right? And just want to open it up to other folks and my colleagues if there's anything else you all would like to add. But that's definitely our intention is, and as to why we have, the regional collaboratives, right? So that we can all learn from each other and recognize the differences that our communities need statewide. So thank you for bringing that up. I super appreciate it.
Yeah, Mike, Alexis here again. I would love to build upon exactly what you just said. I have 3 points to make right now. Number one, one of the reasons why our organization was actually selected to be able to work in the rural North is because of the lived experience and backgrounds that we have actually coming from and working in those communities. I mean, that's just so important. And so I just don't want it to feel lost upon anyone how critical it is that the conveners are reflective of those communities, that like it doesn't work if that's just not present. Number two, which also ties back to the same point, I saw that someone also left a note that for this space to be successful, that we need to have specific goals and specific objectives. And so I want to say once again that those goals and those objectives are going to come from this group. Those are not going to be for us to develop. It's for us to work with you to identify the challenges that CalAIM stakeholders are experiencing, and for us to then work plan to operationalize solutions to those problems. So that development of specific objectives and goals, I think, is a great agreement that we can have, that based upon what's identified, we will work together to develop those shared objectives. And then that last point was just going back to how the competing interests tie into this collaborative specifically. Even though we are going to work together to develop shared goals, each person that's here in each organization that's a part of this collaborative has experienced something different. And so that competing interest may not necessarily be between providers. It could be between the levels of participants. So something that was uplifted was that, one participant felt as though there were different objectives between, a plan and an organization, or DHCS and CBOs at the ground level, so on and so forth. And so because of those competing interests for some of our participants, that was uplifted in another, rural area. And so because of that, we just want to make sure we're having everyone put everything on the table so that way we don't undermine any of those challenges that have been uplifted. And yeah, just once again, thanking you so much for that feedback, because we're taking notes in the background. We take all of this so incredibly seriously, and we want to make sure that we are helping you in this process or working in partnership with you in this process is a much better way to put it. So that way we can develop those very actionable operational plans to move forward.
Thank you, Alexis. And Kara, just wanted to acknowledge your note here in the chat as well, that yes, absolutely. As we learn more, again, this is, our intention to make the space yours. And so we'll continue to just learn from one another and building the space together. And so let me see, there's another question here from Barbara about how did the groups of Shasta, Trinity, Modoc, Lassen, and Siskiyou get grouped together? Shasta is a much larger county with resources and agencies that have more options than Modoc does. That is part of the discussion, right? Thank you so much, Barbara. Do we have Alexis or Melissa? If you could chime in here on Barbara's question there.
Yeah, I think that this is actually a question. I have a yes and response, as my my CEO often says. So with regards to the grouping, number one, we do know that the registrants that were received was a part of that deliberation process on the part of DHCS. How many organizations from various regions were actually going to register and submit interest to participate in this collaborative? And because there are fewer participants or fewer stakeholders in a certain area, some of the counties were grouped together in order to ensure that we could have a collaborative in which there were organizations that could network with one another and coalesce and problem solve, and also share what's going on across county lines in counties that are comparable in some ways. And the and part is I could definitely connect with, DHCS and our administrator of this program to gain more data points. If that response is just not fully sufficient, to learn if there are any other components that were a part of that aggregation component and grouping component, just to make sure I'm not leaving anything out of that response.
Thanks, Alexis. Alrighty, I'm going to keep us moving along, but again, want to make sure that folks know this is, again, a continuing and ongoing space. And so we want to be able to, again, just learn from one another and let us know if there's something that's working great, something that's not working great. We're going to continue to improve as much as we can. And I just wanted to, Doreen, I see your hand as well, so I'll go to you before we close out. Mm-hmm. Oh.
Was on mute. Sorry about that.
Yeah. Mm-hmm.
I guess I just want to piggyback on what T said. There are a number of health collaboratives in place up in the region. So there's the Shasta Health Assessment Redesign Collaborative, which is a whole person care pilot that has had an integrated care committee working very strongly on this, and now CalAIM for 7 years. The Siskiyou County has a health collaborative that went on suspension because of COVID, but the players could be reconvened fairly easy if there was energy to support them. Laston County has a health collaborative that does meet regularly. Then there's a 299 health collaborative, but because of lack, and it's Modoc, Siskiyou, rural part or frontier parts of Shasta, I'm missing one, and Modoc, et cetera. But again, those players have been connected, could be reconvened. They're probably the right people to be working on ECM and CS. So I just think some thinking around that would be helpful to this process. And I'm not sure, how the communications were a little challenging coming from the state on what this was all about and what it was going to be. But I think back to T's point, in rural, we're connected because we need to be, because the resources are limited. Is it perfect? No, but bigger is better when we convene all the stakeholders. And there's various aspects of that could be strengthened, built upon, tapped into, that could really, really support ECM and CS moving further faster. Thank you.
I would like to pile on to that, and that Doreen just has just so many connections and goes back so many years in this area that and Danielle is fairly new to this whole effort, but my gosh, she is dove in into the deep end and done amazing work. And to me, if we all need to have a voice and we all need to speak up and everything. But to me, in this, Danielle and Doreen, with their experience and their background, should really play a big part in my mind in shaping what Health Begins does, because I think they have the background, the relationships, and all those pieces. And I would just advocate for a big voice from the two of them.
Thank you so much. And again, you're getting the kudos there from Alexis. That's exactly what we needed to hear. And I totally agree with that as well. It's our intention for bringing everyone here together. We recognize that not all of the voices are here yet at the table, but how do we continue to get folks here to this table and get connected in these efforts? And so I look forward to continuing to work with you all on making sure that we are speaking to the right folks. Just to share, again, a little bit more background as we're getting to know each other as a part of our work with Everyday Impact Consulting. We've been around for about 10 years, but a part of our recent years, we helped to convene as the project manager in Region 1, which included the counties from Sacramento all the way up to the 17 counties up to the Oregon border. And so if folks are familiar with those 2020 census efforts, our firm was actually supporting the outreach to our hard to count communities, which included our rural communities as well. And so I think just bringing that wealth of knowledge and of course, leaning on you all as the partners on the ground who are, seeing this day in, day out. And so I just really appreciate everyone's input and feedback, and I'll keep us moving along here in our slides. And so if we could just pull up the slides again, Alexis, before we jump into our breakout rooms for today, just wanted to do a little refresher. And so now that you know what CPI is and we've established how we want to work together, we'll go ahead and head into the breakout rooms to really talk about those shared goals for this year. But before doing so, just want to do a quick CalAIM refresher to ensure that participants and everyone here at all stages of engagement understand what we're collectively working to achieve. And so as a refresher, CalAIM's goals are to manage comprehensive needs through a whole person approach that addresses the social drivers of health, working to improve quality outcomes, reduce health disparities, and drive system transformation through value-based reform. And then third, establish a more coordinated, seamless, and cost-efficient system for Medi-Cal beneficiaries. CalAIM will build up the capacity of on-the-ground partners such as CBOs here that are present in public hospitals, county agencies, and tribes to participate. And so we just wanted to do a little CalAIM refresher there for folks who are coming in. Can we go to the next slide as well?
Hi, Michael. This is Alexis.
Okay.
I think I may have been experiencing a lag on this, and has it changed yet?
Yes, it has. Yep, we're on the next one. Thank you. All right, so how can you participate in CalAIM? So you can participate in CalAIM as an enhanced care management or ECM or community supports provider. Number two, your role would be to contract with a managed care plan, provide services, and meet the requirements outlined by the plan and DHCS. And then lastly, we are providing resources that comprehensively explain CalAIM, community supports, and enhanced care management in the appendix of these materials. And it's our ultimate goal to help you successfully participate in CalAIM. So if you have any questions, again, feel free to reach out to us. We're here to help with you in that. In those ways. And so with that, we're going to launch another poll just to get a sense of who's in the room again here. And so if you are an ECM provider, which populations of focus does your organization support? And so thank you for launching the poll. Is it individuals and families experiencing homelessness, high utilizers, adults with serious mental illness, substance use disorder, incarcerated and transitioning into the community, at risk for institutionalization and eligible for LTC, or nursing facility residents transitioning into the community? So thank you all for taking time to answer to the poll. Okay, we've reached about 50% or so. Go ahead and end the poll and share the results. All right, so just looking at that, folks around the room, we've got 89% of ECM providers working with adults with serious mental illness or substance use disorder. Great, and right at high utilizers. Thank you. Okay, thank you all. We're going to move to one more poll if we can. And so if you're a community supports provider, which services do you provide? And just a list here as well: housing services, short-term post-hospitalization housing, recuperative care or respite services, day habilitation programs, nursing facility transition, environmental accessibility and adaptations, medically tailored meals, sobering centers, asthma remediation or homemaker services. So all right. So feel free to continue. We're at 33%. If there's anybody else who wants to add anything, and then we can close the poll in just a moment here. All right, so just looking at the poll results here, we've got 83% housing services, and then short-term post-hospitalization housing, nursing transition, medically tailored meals, asthma remediation, and homemaker services. So for our community supports providers, thank you for sharing that.
If you draw that back, that is very indicative of what you're missing in your community. There's your gap analysis right there, looking at zeros. Now, whether that's important to the people that live in those communities is another story. But if you had a whole bunch of, in the slide before, of drug rehab services, and you have no drug rehab sobering center, that might be a gap that could be worked on if that is what the people living in those communities deem is the most important. It's just another way to look at your data.
Thanks for that, Barbara. Yeah, absolutely. And, you know, we will take the data that we shared in these polls and really help to continue moving the dialogue on these gap areas as well. So I super appreciate that observation. Okay, so with that, I'm going to move us to the next slide. And so for this next activity, we'll be breaking out into our breakout room discussions. What we'll be discussing is number one, a room let me back up here. What we'll be discussing is number one, the project charter, a charter that is collectively designed and a document that states what we are setting out to achieve, how we will measure success, the timeline in which we want to achieve it, and more. And then the second is really the AIM statement. An AIM statement is a specific expression of what we will have accomplished by the end of the collaborative. And so in just a moment here, we're going to break you all out into two rooms. Breakout room A will be with me. That will focus on topics around capacity development and improved care coordination. And then my colleague Vince here will help to facilitate breakout room B, which will focus around data sharing, workflows, and systems. And so with that, I'm going to check in on Alexis or Melissa. Are we ready for the breakout rooms? And then
So I just want to dive in to let everyone know I'm going to launch those breakout rooms. And I also wanted to just quickly flag that we know that there are so many more topics that everyone additionally selected as issue areas so far as CalAIM is concerned when they registered. But these categories that we have separated into breakout rooms A and B for our conversation today received an overwhelming response from the participants. And so because of that, we just want to make sure everyone is in a space where they can discuss what they want, how they want to translate those issues and challenges into objectives and goals. So by the end of this year that we'll spend together, what would the outcome have been? So going back to that just incredibly excellent point that Barbara uplifted, we're immediately, with the data that we're collecting, identifying service gaps. That's only one of the things that we can do together. And so when we are determining these polls and launching this information, it's not just for fun's sake. It's so that way we can actually start to conduct a gap analysis and we can fill in those missing data components, and we can start to analyze. I wish you could see like all of the brain work that's going in on the back end with us just having spreadsheets and spreadsheets of data that we're just really trying to collect specifically to support, this process and making sure that we don't, have the participants feeling as though like the information was lost upon us or is falling on deaf ears. So I just want to, number one, appreciate Barbara for that feedback that was uplifted, because that was just so purposeful. And number two, let everyone know that we know that these breakout rooms are not exhaustive. So to please, just go into the breakout room that feels like it's more reflective of, the conversation you want to have today. That being said, I am going to go ahead and launch these breakout rooms.
Oh, sorry, Alexis. One more thing before we jump into the breakout rooms. I just wanted to also share that we have, if you could go 2 slides, Alexis, and just share the prompts as well. Just wanted to really give you all a framework of what we'll be discussing in the breakout rooms as well. And so you'll see the same questions up on the slides that you will be going into. But again, please self-select a room that you'd like to have a discussion around, and then we will see you back here in about 15 or so minutes. And so with that, thank you, Alexis, for breaking us out, and we'll see you in the rooms.
Hey, everyone.
So is this our breakout session?
I know.
I
So
guess.
I'm a little confused. Yeah.
yeah, sorry about that. If you want to join a breakout, if you go to the bottom of your screen, there should be like a 4 square box that says breakout rooms. And there is breakout room A, which is on capacity development and improved care coordination, or breakout room B, which is supposed to be on data sharing.
Got it. Okay, thank you.
So if folks want to pick one.
So what if I don't have that on the bottom of my screen?
Oh, you don't have, it might be at the top of your screen. Some people have it kind of on different parts of their screen. It's wherever you usually see like the mute or stop button.
Okay, so I have a mute and a start video.
And then on that same panel, is there something that says like participants, chat?
Yes, I have all of those. I have participants, chat, share screen. Oh, look, at now it pops up.
There, yeah.
And the care coordination is A, right?
Care coordination is A.
Thank you so much.
No problem.
All right.
And I don't have the feature either, but I figured it's okay because I'm just here to listen.
Okay. Yeah, and if you want to join, you're welcome to join. Danielle, I'm Sadhana, by the way. I've worked, I think we've been on meetings together, and then also have worked with a number of your peers.
Yeah. So it's okay. I can hang out and then, hear the kind of the recaps. That way their voices are heard, right? Because it's not about the partnership, not about the managed care plan, right? It's about our providers in the community. So I'm good with just waiting to hear back.
Okay, I appreciate that. And it sounds like, your reputation precedes you in the room. So loved hearing that feedback.
Right. It was really nice. I was like, oh, but anyway, so I want to be here to support as much as possible, like I said, and not to sound like a broken record, but, we're going to do this together. So I get it.
That's awesome. Thanks so much.
Yep.
It looks like we beat everyone else.
Maybe we'll just give them a couple more minutes and then,
Yeah, I think we got out a little earlier than they did. But they should be trickling back in.
They could be just sitting there like we were before, because I don't know how to use
that could
365.
be
You
it.
just got it. And if it wasn't for your good instruction, Melissa, or whoever it was that provided, hey, you touched this button.
There we go. Welcome back, everyone.
Welcome back.
Oh no, and Vince, I just realized that we were busy talking. We didn't identify someone to report back.
Maybe we can ask for a volunteer from our group.
Yeah, if Jenna or T would like to uplift some of the challenges that they identified and would like to have us, focus on and prioritize either regarding the HIE or just CalAIM, like understanding the moving parts and components, very different points of feedback, but all just so important.
Yes, thank you, Alexis. So maybe at this point, we can have some sharing about what you heard in breakout room A, and let's start with that, and then followed by our breakout room. Maiku, did you identify a reporter?
Yes, we did, Brianna. Yep.
Go ahead.
Hi, I'm Brianna Moncada. We provide medically tailored meals for Mom's Meals for community supports. And some challenges that we discussed were, knowing about the program, how to refer. I know there's challenges with certain requirements from the health plan, whether it be about reporting or, other kind of requirements there that in turn are requested from the state, and just really kind of understanding what the needs are within the community. Is there anything that I missed there?
I can add a little bit more if you'd like. So some other things that we heard were that there's a lot of these counties are cross-referring, and so setting up systems to be able to ensure that these community members that the providers are working with are actually making it to those appointments, and making sure that families aren't falling through the cracks. So ensuring that the workforce development is really built out in the next couple of years. Again, to ensure that we're getting the best bang for our buck, basically, and also really making sure that these individuals within these rural communities are accessing the care that they need. I'm wondering if there's anything else. We really touched on like developing a really sound workforce, and then also just creating these peer support networks, especially among cross collaboration with these more rural counties. And if there's anyone in breakout room A that wants to also chime in, if we missed anything, please feel free to unmute.
I wanted to ask a question actually that just came up, and maybe we could save this for later, but just thinking about that cross referring to different counties, do providers usually receive, or the referring provider, do they receive like a notification that their member received services? Or like, how would you know that unless you talk to, if you're a case manager and you're managing, or ECM provider, how would you know that your referral was completed?
And this is Danielle, I can speak to that. So we have a closed loop referral system. And so we do, I think it's a collaborative effort. I know that obviously to the future, we want to look at a system, a platform that gives us all that information, but it is a collaborative effort between the enhanced care management lead care manager and also the community supports provider. They have to work together. But we also notify the community supports provider once a referral has been approved, and same with ECM.
Yes, wonderful. Yeah, we receive we get started with them, and obviously then the member knows. I just wanted to make sure that the referring party also knows. So that's great to hear. Thank you.
Oh, Vince, you're on mute.
Thank you for that feedback from your breakout session, Maiku and Brianna and Melissa. Let's move on to breakout session B. May we ask Jenna or T to give some insights? We had really in-depth and some detailed conversation in our breakout session. Either one, would you like to chime in?
I can go first. Maybe T, if you want to talk about what you talked about, but I just mentioned as the correctional discharge planner, having some issues because I'm under, public health, and I'm underneath the Health and Human Services Agency umbrella. Just talked about the data sharing with our Medi-Cal or welfare department, and needing a release of information or needing a memorandum of understanding, or if I'm able to communicate with them, since we're technically a part of the same agency and I'm not within corrections. So just or like within the sheriff's department. So I'm just curious about that, because I know my upper management there's been some confusion and trying to figure out how to make that work for our county.
Appreciate that, Jenna. Thank you. And I just want to read here T's comment. Main point was that many involved in ECM/CS are already on Sac Valley MedShare. It would be huge if we could find a way to get CBOs on as well. We also thank you for that input, T, and we also lifted up that we would like to reach out to you, NT, and others in our group for more individual kind of feedback to get more details. Certainly, this collaborative with Sac Valley MedShare was lifted up as a potential model and what worked. So we'd love to get more information on that. So at this point, thank you for the reflections from our breakout rooms. Can we go back to the next slide? So at this point, we're hoping that you have some improved understanding of what we're trying to do in the space. We have some guiding principles that we've shared. We also shared a slide about the project charter as well as the AIM statement. And we've also shared some final reflections from both Breakout Room A and Breakout Room B. As I mentioned earlier, we would also want to connect with you individually on some of the highlights that were mentioned in our breakout rooms to learn more and enrich our conversation and collaboration. Next slide. So some of the key takeaways that we have from today, our jointly developed guiding principles will inform how we work together. And number two, based on the results of the breakout session, a formal AIM statement and project charter will be developed and shared with this group. For next steps, I'm going to turn it over to Maiku.
Hey, thank you so much, Vince. Really appreciate all of the conversations and discussion that we've already had for today. So I just want to wrap us up in like the next minute or so with some quick next steps as to what to expect after this meeting. And so next month's session will focus on work planning. And we heard a little bit of that today, really wanting to dig deep, dive right in and get started. And so that's exactly what we'll do starting in next week's next month's session. After today, you'll expect to receive a post-event email. It will include an assessment. So please complete the survey in the post-event email to determine what work planning will happen in the February session. For registration, please use the link in our follow-up email to register for the February session. And then lastly, let's network, right? We'll share a networking program for us to stay connected, ask any questions, share best practices between sessions. And so just continuing the conversations from today, our session here is recorded. And so slides and supplemental materials will be provided via email. If you have any questions, please feel free to contact Shiva here on the Health Begins team for any questions pertaining to the collaborative. And then Lastly, what we've heard loud and clear today, support recruitment, spread the word to other potential CalAIM stakeholders and encourage them to join us in these monthly meetings as well. And so I just want to close us out if we can move to the next slide as well. I want to give a special thanks to all of you for showing up today with us. I want to say thank you to our Health Begins PATH CPI project team. Same with my colleagues here at Everyday Impact Consulting, Casey and Vince, thank you all. And again, we are going to share these slides, but at the end of these slides, you'll see that there's also resources that you all can really click through as well. And I just want to close us out by saying thank you again for your time. We are here, reach out to us, but we are also going to be reaching out to some of you all who we heard from today and just really work with you all together on this over the next several months. And so with that, I will go ahead and close us out. Thank you.
Thank you.